Patients who are getting augmentation, one of the most commonly asked questions is, what implant is right for me? What size should I get? What profile should I get? And it can be a very complicated and overwhelming topic for patients who are researching on the internet, because it's a little overwhelming. There's hundreds of implants to choose from. And it's our jobs as surgeons is to find an implant that fits the patient's body habitus, their frame, their soft tissue, laxity, space. All these things are kind of important to control when you're doing an augmentation. And that comes also in addition with patient desires. And if patients want to look like just a little bit fuller in a bra versus I want to be very noticeable that I have an augmentation. Those two extremes are two different type implant volumes and two different implant profiles, really. That's the nature of it. So my job is when patients come visit with me is to find out what they want as far as their look. I'm going to do examination, what limitations we have as far as their body habitus and body and their frame, and then find something that fits, okay? That volume could be 300 cc's for one patient who's like 5'6", 130 pounds. It could be 500 cc's for someone who's 5'10", 180 pounds. It just depends. So the myth of bra sizes, I want to be a certain bra size, it's very difficult to predict because these bra sizes are very arbitrary as far as different styles and makes and styles of bras. It can vary. What I encourage is patients find an implant that size and projection that fits their body habitus and proportions, is not too top heavy, kind of keeps you in balance with the shoulder width, the waist ratio. I think balance is more important for the long term, in my opinion, but it's really the patient's desire. And then my job is to find something that can be safely done, that will not cause complications with larger implants that are too much for a patient, really. And if we focus on those three things, I think the patient's outcomes are dramatically better.